My name is Dr. Hemalatha Mallaya. I am consultant pediatrician and neonatologist in Cloud9 Hospital, Tanisandra branch. So today I will be talking you regarding sterilization of bottles, especially to those mothers who give bottle feeding for their babies. So it's a common question most of the mothers ask in the OPD. So as per the CDC Center for Disease Control, this committee advises that sterilize your bottles after every use, at least till 12 months of age. Especially in country where we don't have clean water, that countries also you should sterilize their bottles after every use. So what will happen if you don't sterilize the bottles? These bottles and teats have nooks and corners where the milk accumulates if not properly cleaned. This milk acts as a source of media for the germs to grow. The baby will definitely catch hold of infections, can cause vomiting and diarrhea. So it's very important to sterilize the bottle. So how to sterilize? Before sterilizing, you should remove the parts of the bottle properly, dismantle the bottle. You should remove the nipple, you should remove the teats, you should remove the cap and wash this bottle and teats separately under clean running water. Then you can use a brush to separately clean the bottles. Use a brush separately to clean the teats also. Then you can sterilize. So there are various ways of sterilization. You can put the bottles and teat in boiling water and boil it for 10-15 minutes. That will help to sterilize. There are various chemicals which are available to sterilize. You can even use the microwave to sterilize. So these are the important ways of sterilization. So it's always mandatory for all babies, especially those with the immunodeficiency disorders, those preterm babies. You should sterilize after every feed and you should continue the sterilization till 1 year of age.